It is now my privilege to introduce Dr. Ivor Mendez. Dr. Mendez is the Fred H. Wigmore Professor and Unified Head of the Department of Surgery at the University of Saskatchewan and Saskatoon Health Region. Dr. Mendez received his MD and PhD in anatomy from the University of Western Ontario, London, Ontario, where he also completed his postgraduate training in neurosurgery. After completion of his neurosurgical residency, Dr. Mendez was awarded the Resident Research Prize by the American Congress of Neurological Surgeons and the William P. Van Wagenen Fellowship by the American Association of Neurological Surgeons. His research fellowship was done at the Department of Medical Cell Research, University of Lund, Sweden, from 2000 to 2012. Dr. Mendez was the chairman and founding member of the Halifax Brain Repair Centre, the most comprehensive neuroscience research institute in Atlantic Canada. Dr. Mendez was the head of the Division of Neurosurgery at Dalhousie University and the QE2 Health Science Centre for more than a decade. Dr. Mendez is a fellow of the Royal College of Physicians and Surgeons of Canada and the American College of Surgeons. As a clinician scientist, Dr. Mendez's research focuses in on functional neurosurgery, brain repair, stem cells, robotic neurosurgery, and computerized systems in neurosurgical applications. His laboratory research has been supported by peer-reviewed funding from a number of sources, including the Canada National Centres of Excellence, Canadian Institutes of Health Research, Canada Foundation for Innovation, and Parkinson's Disease Foundation of USA. He is recognized internationally as an expert in his field, having over 200 international and national presentations, as well as over 200 scientific publications. For the past decade, he's worked in the use of remote presence robots for medical care in neurosurgery. In 2002, Dr. Mendez and his team performed the first long-distance telemonitoring neurosurgery in the world. And in 2013, he reported the first experience in remote programming for neuromodulation devices. Dr. Mendez was the president of the Canadian Neuromodulation Society from 2009 to 2012, and under his leadership, he promoted the access of neuromodulation therapy to all citizens of Canada. Dr. Mendez has taken an active role in humanitarian and global health issues. He's been instrumental in establishing and equipping neurosurgical units in several developing countries. Through the Ivor Mendez International Foundation, he's instituted programs for school breakfasts, dental care, and computer education in his native Bolivia. In 2010, Dr. Mendez was awarded a Canadian Red Cross Humanitarian of the Year award and was named one of 10 most influential Hispanic Canadians for his clinical research and humanitarian contributions. Dr. Mendez also received the Health Canada 2011 Contribution to the Improvement of the Health of Canadians Award and the Queen Elizabeth II Diamond Jubilee Medal in 2002. In 2014, St. Mary's University in Nova Scotia awarded Dr. Mendez a Doctor of Science degree for his contribution to neuroscience, and he was inducted as a fellow into the Canadian Academy of Health Sciences. Dr. Mendez is also a gifted photographer and sculptor. He's published 3 books of photography of Bolivia and has exhibited his sculptures in Bolivia, Canada, and the United States. Please join me in welcoming our distinguished guest, Dr. Ivor Mendez. Dr. Mendez, thank you for joining us today at our Celebrating Life Education Conference for Parkinson Canada, and appreciate you taking this time to just answer a few questions. Of course, big questions that people have is around the area of stem cells and your work that's going on there. So I thought I'd just ask, how long have you been doing research into stem cells and as it relates to Parkinson's disease?
Well, it's over 25 years. When I was training as a neurosurgeon, I became interested in the idea of regeneration, to be able to actually replace the cells that die in Parkinson's disease, which are the dopaminergic cells, as you know. And when I was training as a neurosurgeon, a new field started to open. There was some research that was being done in Sweden, and I decided to actually take 2 years of my training to do a PhD in cell transplantation. And my research started at that time, and then it's been going on for the past 25 years.
Well, that's exciting. That's a lot of experience. So tell us just in a moment. I know you're doing a large presentation today, but if you can summarize, what is the idea of stem cells in regards to Parkinson's disease?
Yes. Well, the philosophy is as follows. As you know, the Parkinson's disease what it does, it affects these very specific cells of the brain, the cells that produce the chemical dopamine. And they degenerate over a long period of time. Actually, 80% of the cells die before patients start having the symptoms. So the idea is very simple. Can we replace those cells that have died with new cells that can reconstruct the circuitry of the brain, and can that improve the function of the patient? And although that idea in its inception appears to be very simple, of course the question is, can the cell, for example, survive the transplantation procedure? Once it's into the brain of the patient, can it connect with the right cells? Can they talk to the right cells? If they connect with the right cells, can they improve function? And there has been almost 2 decades of work in animal models that have proved the principle that yes, that we can put a new cell into the mammalian brain in an animal model, for example, and we can get that cell not only to survive the transplantation procedure, but to reconnect with the cells of the host brain and produce improvement of function. So that has been the impetus of the idea of cell therapy. And that then came together with this really explosion of research on what we call stem cells. And what is a stem cell? Stem cell is a cell that can actually be taken from the body and can become any cell of the body. It's kind of a primordial cell. It's a cell that can be differentiated into any cell of the body. And over the past decade or so, there has been enough research that have shown that we can actually take that cell from the patient himself or herself, and then take that cell either from the bone marrow or from the skin, and then we can make that cell to become a cell of the brain, and further, we can make that cell to become a dopaminergic cell of the brain, and then implant it back into the patient. That is the idea. Can we reconstruct the cells of the brain of a patient with Parkinson's disease with their own stem cells?
So you'd be looking at taking a basic kind of a cell and then turning it into a stem cell and then into this kind of cell that produces the dopamine.
Exactly.
It's quite remarkable.
Yeah, and of course the beauty for this whole procedure is that it will be your own stem cell. So what that does, it avoids this significant issue of rejection. You know, you're not taking the cell of somebody else as in solid organ transplantation. When we transplant a kidney, for example, or a heart, you know, you may be taking that from a donor. And one of the issues with that is that the body actually tends to reject that organ. Even though it may be a relative of yours, the compatibility is not perfect. So the patients need immunosuppressive therapy. They need very powerful drugs to suppress the immune system so you don't reject the organ. In this case, it will be your own cell, so the body will not reject that cell. So there's really it's opened this new way that we can look at cell therapy for Parkinson's disease that is tremendously exciting.
So then, what are the biggest challenges that you face in the next couple of years in regards to this research and this process?
You know, one of the very important issues is, can we refine the procedure to the point that every time we take the cell from the patient, we can then make it a dopaminergic cell. It is not as simple. It is a very complex procedure to be able to take this stem cell to become this dopamine cell, and that always will become a dopamine cell and not any other cell. Okay. So that on itself is very, very important, because it will be crucial to have the appropriate cell that will be able to reconstruct the circuitry. Other cell will not do. It has to be the dopamine cell from the substantia nigra. And that is one of the scientific challenges that is being worked around the world to see if we can have a procedure that is reliable enough. And when I say reliable enough, that it works 100% of the time. Because you can imagine putting a cell into the brain, you really need to put the appropriate cell that will do the thing that you want that cell to do, nothing else.
Nothing else. Yes, that makes sense. So where are we at in this process then?
Well, you know, we've advanced quite a bit over these past decade or so. You know, our first experience was using fetal cells for transplantation, and with that experience, we developed the surgical procedures, we developed the surgical instruments, we developed actually the technique of the operation to put a cell into the brain and have that cell survive. Now we're working in the biology of the stem cell, the cell that will be taken from the same patient that will receive that cell from the same Parkinsonian patient. And that is where we're working now. And this is where a lot of effort has to be made to be absolutely sure that the cell is the right cell and that goes into the right place.
Excellent. Well, thank you. And so then, how would someone living with Parkinson's get involved with this? Is there clinical trials or any other way that they can get engaged?
You know, one of the things that has been really exciting is that for the first time I can say that somebody that has Parkinson's disease now can see the possibility that in the near future, when I say the near future, a few years, we may be able to reconstruct the circuitry of the brain. This possibility was not existent, you know, a few years ago, because the idea, even when I went into medical school, the idea was that if a cell will either degenerate or be injured into the brain, that will be it. There will not be the replacement of the cells, or there will be no regeneration. Now, for the first time, we can see really the light at the end of the tunnel. The science, the technology, and the knowledge has improved over this past decade that really can allow us to envision truly the potential in the future to have cell replacement therapy, not only for Parkinson's disease, but of course for other neurological conditions. What I see in Parkinson's disease is this window that may open a bright future. In Parkinson's disease, there's one cell that we need to replace, but there's conditions like stroke, Alzheimer's disease, MS, that may be able to be repaired using stem cell therapy.
Well, it's very exciting. As you can imagine, it's created a lot of buzz in the Parkinson's community because it gives that promise of hope. So on that theme of hope, what would you say to Parkinson's patients?
Yeah. Well, the first thing that I should say is that this work is being done in Saskatchewan, here in Saskatoon. And this is important for our community here in Saskatchewan because they will be close to this development. And the patients, the first patients that are recruited for the trial will probably come from Saskatchewan. So those are good news for the people of our community. There's enough work now being done in all the aspects of the trial, and we hope that within the next couple of years or so, we will be able to start recruiting patients. And that is really something that I think opens this hope of people living with Parkinson's disease. At the same time, we are continuing to work with the other therapies that are available now. Of course, the drug therapy, which is the front line of therapy for Parkinson's disease, deep brain stimulation, which is now routinely offered here in Saskatoon. And we are assembling this critical mass of investigators and clinicians that will provide truly world-class care to the people that suffer with Parkinson's disease in our community and in Canada as a whole.
Excellent, excellent. Well, thank you, sir, for taking this time. We really appreciate it, and we're just really encouraged that we wish you all the best in this study, and we hope to hear really good things in the next couple of years.
Thank you so much.
Thank you.
Thank you.